What if I told you that something many people consider harmless, even healthy, could quietly influence memory as we grow older? I know that might sound surprising, and you may already be thinking, I've heard warnings like this before, or fruits are natural. How could they be a problem? That reaction makes complete sense. For decades, we've been encouraged to trust familiar foods without questioning them, especially when they've been part of our daily lives for years. My name is Dr. Linda Harrison. I'm a medical doctor, and for the past 23 years, I've worked closely with men and women in their 60s and 70s. I've listened to their concerns, followed their progress over time, and watched patterns emerge that aren't always talked about openly. Many of my patients come to me saying the same thing. Doctor, I'm forgetting names more often, or I walk into a room and can't remember why, or my memory just doesn't feel as sharp as it used to. And almost always they add, I thought this was just normal aging. Aging does bring changes, that's true. But what worries me is how often subtle memory decline is dismissed or overlooked, especially when it develops quietly. After the age of 60, the brain becomes more sensitive to small, repeated influences. Things that may not matter much at 40 or 50 can have a very different impact later in life. Memory, focus, and mental clarity depend on a delicate balance inside the body, and that balance becomes easier to disturb with time. I want to be very clear and calm here. This is not about panic, and it's not about blaming anyone for their habits. It's about awareness. Over the years, I've seen patients who were doing many things right. They stayed active, they socialized, they read. They tried to eat what they believed was a healthy diet. And yet, their memory slowly declined in ways that didn't fully make sense to them. What stood out to me was how often certain everyday foods were never even considered as a possible factor. You might be wondering why this matters so much after 60. The reason is simple, but important. As we age, the brain's ability to adapt and recover changes. Blood sugar regulation, inflammation levels, and how brain cells communicate with each other all shift gradually. These changes don't announce themselves loudly. They happen quietly, over years. That's why memory issues in older adults often feel confusing and frustrating. There's no single moment where everything changes. Instead, it feels like a slow fading that's hard to explain. I've sat across from patients who felt embarrassed to bring up memory concerns because they didn't want to seem dramatic. Others felt afraid that even mentioning memory meant something serious. And many assumed that if something came from nature, it couldn't possibly be part of the problem. I understand that thinking. It's human. But in medicine, we learn that context matters, amounts matter, timing matters, and age matters. This topic is especially close to my heart because memory is tied so deeply to independence, confidence, and identity. When memory begins to slip, even in small ways, it can affect how safe a person feels driving, managing daily tasks, or holding conversations. It can quietly chip away at self-trust. And that's something I never want my patients, or you, to face without understanding what might be contributing. So today, I want to gently open a conversation about a memory concern that often goes unnoticed in older adults. Not to alarm you, and not to tell you what to do, but to help you see the bigger picture. Because when we understand why something matters, especially at this stage of life, we're in a much better position to protect what's most important to us: our clarity, our dignity, and our quality of life. As we get older, the body doesn't process foods in quite the same way it once did, and this is especially true for the brain. One of the most important changes after age 60 involves how the brain uses energy. The brain relies heavily on a steady, balanced supply of fuel, mainly from glucose in the blood. In younger years, the body adjusts quickly when sugar levels rise or fall. With age, that adjustment becomes slower and less precise, which means repeated spikes can place quiet stress on brain cells over time. One key mechanism involves blood sugar fluctuations. Certain fruits contain concentrated natural sugars that are absorbed very quickly. Even though the sugar is natural, the body still has to manage it. Think of blood sugar like the speed of traffic on a road. When it flows smoothly, everything works well. But when there are sudden surges, followed by drops, it creates strain. In the aging brain, these repeated surges can interfere with how brain cells communicate, especially in areas responsible for memory and learning. Another important process is inflammation. As we age, the body tends to exist in a slightly more inflamed state than it did earlier in life. This is sometimes called low-grade inflammation, and it doesn't feel like pain or illness. It's more like a background hum. Certain dietary compounds can quietly add to this inflammation when consumed frequently or in large amounts. In the brain, inflammation can affect the delicate connections between nerve cells, making it harder for memories to form clearly or be recalled later. There is also the matter of blood vessels. Memory depends on healthy circulation. The brain needs a constant supply of oxygen and nutrients, delivered through very small, delicate blood vessels. With age, these vessels become more sensitive to damage. Repeated metabolic stress, including rapid sugar absorption, can affect the inner lining of blood vessels. You can think of it like wear on plumbing over time. When the flow isn't as smooth, the brain may not receive everything it needs to function at its best. Another mechanism that often goes unnoticed is how certain sugars interact with brain signaling chemicals. These chemicals, called neurotransmitters, act like messengers passing information from one brain cell to another. Stable levels help us focus, think clearly, and remember details. Rapid changes in blood chemistry can disrupt this balance, making signaling less efficient. Over time, this can feel like mental fog, slower recall, or difficulty concentrating, even when a person is otherwise healthy. Finally, there is the connection between the gut and the brain. This relationship becomes increasingly important with age. The gut helps regulate inflammation, blood sugar, and even mood-related chemicals. Certain foods can shift the balance of gut bacteria in subtle ways. When that balance changes, it can send signals to the brain that influence clarity and memory. It's a bit like tuning a radio. Small changes in the signal can affect how clearly the message comes through. All of these processes happen quietly. There is no sudden alarm, no immediate symptom that says something is wrong. That's why this topic deserves careful attention, especially later in life. Memory changes are rarely caused by a single factor. They are usually the result of many small influences, adding up over time, particularly in a body that has already adapted to decades of change. I remember a woman in her late 60s who came to see me feeling quietly unsettled. She wasn't frightened, just confused. She told me she still managed her home well, paid her bills, and stayed socially active, yet small moments were starting to slip through her fingers. She would pause mid-sentence, searching for a word she used effortlessly her entire life. She would reread the same paragraph in a book and realize it hadn't stayed with her. What troubled her most was not the forgetfulness itself, but the unpredictability of it. Some days felt clear, others felt hazy, and she couldn't understand why. She was very thoughtful about her lifestyle. She didn't skip meals, she walked regularly, and she genuinely believed she was making good choices. When we talked through her daily routines, she kept saying, "I don't understand, doctor. I've always eaten what I thought was healthy." There was frustration in her voice, and also a quiet sense of self-doubt. She began second-guessing herself, wondering if she was simply getting older faster than she should. Another patient, a man in his early 70s, described a different kind of struggle. He told me he felt mentally slower in the mornings, as if his thoughts needed extra time to warm up. He had moments where he would forget why he opened the refrigerator, or lose track of conversations in busy rooms. What bothered him was how this affected his confidence. He started letting his wife handle tasks he once enjoyed, not because he couldn't do them, but because he didn't trust his memory the way he used to. He said, "It's like my mind is there, but it's not always responding when I call on it." In both cases, the changes were subtle. No dramatic decline, no sudden loss of independence, just a gradual shift that made everyday life feel slightly heavier. And that's exactly how the processes we discussed earlier tend to show themselves. The brain doesn't shut down suddenly. Instead, it reacts to repeated small stresses. Fluctuating energy supply, low-level inflammation, and less efficient signaling between brain cells don't announce themselves loudly. They show up as hesitation, mental fatigue, and moments of fog that feel hard to explain. What stood out to me in these conversations was the emotional weight these experiences carried. Both patients felt isolated in their concerns. Friends brushed it off as normal aging. And while aging does play a role, that explanation didn't fully sit right with them. They knew themselves well enough to sense that something had changed. That awareness, paired with uncertainty, often leads to quiet anxiety, not panic, but a lingering question in the back of the mind. Is this how it's going to be from now on? I want you to know that these feelings are very common. Many older adults experience memory changes that don't fit neatly into a single explanation. The body after 60 is more sensitive to patterns that build slowly. When the brain's energy balance is disrupted again and again, when circulation becomes slightly less efficient, or when signaling between cells loses its rhythm, daily tasks can feel more demanding than they once did. That doesn't mean something is permanently broken. It means the system is responding to accumulated influences. What gives me hope, and what I want to gently pass on to you, is that understanding these connections often brings relief. When people realize their experiences have a biological explanation, not a personal failure, their shoulders relax. The confusion begins to lift. Memory changes stop feeling like a mystery or a moral flaw and start to make sense within the larger picture of how the aging body works. And that understanding alone can restore a sense of clarity and calm that many people didn't realize they had lost. At this point, what matters most is awareness, not vigilance rooted in fear, but gentle attention to patterns in daily life. Memory does not usually change overnight. It shifts in small ways, often tied to routines we repeat without much thought. Paying attention means noticing how your mind feels throughout the day, whether clarity comes and goes, and whether certain habits seem to coincide with feeling mentally sharper or more foggy. These observations are not about judging yourself. They are about understanding your own body with curiosity and kindness. One common misunderstanding I see is the belief that if something is natural, it must always be harmless in any amount. Nature gives us many wonderful things, but even natural substances interact with an aging body differently than they did decades earlier. Another misunderstanding is assuming that memory changes automatically means something serious or irreversible. That assumption can cause unnecessary worry. In reality, memory is influenced by many overlapping factors, including sleep, stress, circulation, metabolism, and long-established habits. Looking at the whole picture is far more helpful than focusing on one detail in isolation. It's also important to remember that memory concerns are deeply personal. Two people of the same age can have very different experiences. What affects one person noticeably may barely touch another. That's why broad statements rarely tell the full story. Your medical history, your current medications, and your overall health all matter. This is where thoughtful, informed conversations with a physician become so valuable. A doctor who knows you can help put changes into context, rather than jumping to conclusions. I want to be very clear and reassuring here. Nothing you hear in a discussion like this should ever lead you to stop a medication, supplement, or prescribed treatment on your own. Medications are chosen for specific reasons, and any changes should always be guided by a healthcare professional who understands your full situation. Awareness is about asking better questions, not making sudden decisions. After the age of 60, balance becomes especially important. Many things that offer benefits can also carry subtle effects when combined with age-related changes in the body. That doesn't mean avoiding them entirely. It means understanding that moderation, timing, and individual differences matter more now than they once did. Health at this stage of life is not about perfection. It's about informed choices and ongoing care. If memory changes have crossed your mind recently, I want you to hear this clearly. You are not alone, and you are not imagining things. At the same time, you are not powerless. Knowledge allows you to move from quiet worry to calm understanding. When you understand how your body works now, you can approach your health with confidence instead of fear. Aging is not a failure of the body. It is a process of adaptation. With the right awareness and medical guidance, many people continue to live mentally engaged, meaningful lives well into later years. My hope is that this conversation helps you feel more informed, more grounded, and more at ease with the changes you may notice along the way. This is about caring for your long-term health with patience, clarity, and respect for yourself.